Hello, my name is Lane Sevier. I'm a dentist in Knoxville, Tennessee. I'm here today talking about oral health and just kind of how to evaluate and discover signs of problems within adults, children, individuals maybe with special needs, senior citizens, anything along those lines. So basically what we're looking for to find, pain or problems within an individual, the obvious is going to be if they tell you, right? If somebody tells you that they have a painful tooth, a problem, that's pretty obvious. If it's somebody that can't talk or can't explain things very well, generally you're going to be providing for them, right? So you're going to be brushing their teeth, you're going to be helping them out. What you're going to want to be looking for is anytime you touch a particular spot in their mouth, do they wince? Do they struggle? Do they, shy away from that? That's going to be a pretty obvious sign. From there, you're really just looking at visual things. Plaque, tartar, food products, different things get stuck within an individual's teeth. Say senior citizens, older individuals with Alzheimer's, Parkinson's, they can't really clean their mouth very well. Caretakers are going to be looking for an actual film. Does it look like there's something stuck to their teeth, right? You're going to want to get in, brush, help them take care of that stuff. Kids, they're not going to develop that as much as an older individual, but you still want to be looking that you don't see any residue along their teeth. From there, you're going to be looking for an actual broken tooth. That's usually pretty easy to find with just a quick look. If it's not that obvious, you're looking for color. Usually a cavity is going to show up as black, gray, brown, colors outside of what you would expect a normal tooth to look like. So if you see a big black space on a tooth that, traditionally hasn't been there, more than likely that's a cavity developing. If you see a hole or a crater in a tooth, a missing part of a tooth, clearly these are things you want to be looking for, especially if you're a caretaker. When you're brushing teeth and cleaning things, you just want to make sure that you're really taking stock of what is there. Kind of finally would be gums presents probably more than often an oral infection, okay? So when you're looking for an infection, you're not really looking at the tooth so much. If you pull the lip back, you're going to see a bump on the gum. If you see what looks like a pimple next to a tooth, that is an infection. That's what an abscess looks like. So again, if you're a caretaker for a child, for an adult, anybody with a tooth, and you're doing your usual exams or cleanings and you're just trying to help take care of them, as you're taking care of them, make sure that you're also pulling the lip back a little bit and looking at the gums. If you see, again, a pimple or a swelling, that is an infection in that tooth. That's when you'd be wanting to get them to a dental office so that they can get an appropriate antibiotic prescribed, potentially remove that tooth, or do other treatments like a root canal to get rid of that infection. So as a dentist, when we're working on patients, clearly we want them to be comfortable. So what are the things that we're looking for, say, that a patient would present with during treatment? When we're working on a patient, signs that I'm looking for to make sure they're having a good experience, making sure they are comfortable, is they should just be laying on the chair just as they would be watching TV, right? You want them in a rested position. If you have your drill on and you're making noise and you're working on a tooth and they start kind of fidgeting, moving around, kind of rolling from side to side, or obvious moaning, groaning, stating that they're in pain, that's clear and obvious. But if they can't talk, if they have a hard time, orally presenting their case, you're really just looking for movement, right? Are they moving in ways that aren't normal for them? Then these are the ways that that they're having some pain. You probably want to get back and get a little more numbing. But at home, if you're taking care of them, and if they're, again, they can't verbally describe what they're feeling and they can't, say, talk due to whatever circumstance, if you're brushing their teeth and you're trying to take care of them and they're really just squirming and wincing, or again, just making these bodily movements and jerking their head back and moving around, and they haven't traditionally done this for you, that's a pretty good sign that there's probably an issue in that area you want to go get looked at. Yeah, my name is Dr. Lane Sevier, dentist at Knox County Dental in Knoxville, Tennessee. If you like this video, like, subscribe, share with your friends. If any of these people that you're taking care of present with any of these symptoms, signs, problems within their mouth, their teeth, their gums, please help them find a local dental provider to help get them taken care of.